Welcome back to Iron Insights. As you know, today we are talking about EDTA chelation with our guest, Dr. Jeffrey Morrison. Now, we were talking now about IVs. Now, is it possible of providing this in any other way?
Well, certainly IV chelation therapy is the most effective because it delivers the medicine directly into the bloodstream. And specifically for EDTA, that is the best route of administration because it's very poorly absorbed orally. But there are other ways for people that might have poor vein access, or they don't have a local doctor to give the IV treatments. So specifically for EDTA, there are rectal suppositories that are options. For the other chelating agents, they can be taken orally, and they're absorbed generally pretty well. EDTA has a very poor oral absorption. It's maybe 10%. And rectally, it's about 20 to 30%. But intravenously, it's 100%.
Right. How effective is the rectal one, the suppositories?
It's really anecdotal to talk about the benefits, but some of our colleagues have been doing it and reporting their successes and feel that it probably is like a 1-to-5 ratio. One IV chelation might equal 5 rectal suppositories. So a person just has to be comfortable with that treatment route. And in my personal opinion, I would say that we've seen lots of great successes with the IV treatment strategy, so I can speak confidently about that.
Now, what is the time span we're talking about? Of course, it depends on also how bad the blockages are and so on, but what are we talking on the average that the average person would need, if there is such a thing as an average person, in order to really reach a point where they don't need the chelation?
In the chelation study, the TACT trial, there was a weekly IV infusion for 40 weeks. And over that 40-week period, from beginning to end, that's where they saw the significant improvement. So we know at least 40 weeks of treatment is what is recommended. And some people do longer for additional benefit. The good news is that it's been shown to be safe and effective for treating cardiovascular disease, and it's published in the medical literature.
There's also seemingly anecdotal evidence that it also would be very good for some of the other degenerative diseases like Alzheimer's, that they found that the people that did have chelation and had Alzheimer's, that they were able to actually come back practically.
Yeah, it's remarkable about what the implications of this treatment are. Certainly Alzheimer's, especially because of the suspected aluminum relationship with Alzheimer's disease. So calcium EDTA does pull aluminum out of the tissue. So it's great for that. Also scleroderma, which is a difficult to treat condition, seems to improve with this type of treatment. Probably the list will go on, but specifically because EDTA not only pulls out heavy metals, but because it stimulates nitric oxide production, which I think is really the true breakthrough.
That's the key
element. Right? The key element of how this is working at this point.
Now, what do you see as the pathway for the future with this? That we should start getting people practically from an early youth area on with chelation or some form of chelation therapy, because everybody has actually heavy metals.
Well, certainly we know that the healthcare system is looking for new ways to prevent diseases and less expensive ways. We know that if a person waits until they start having cardiac symptoms, that's usually a road to failure, where there's going to be prescription medications or bypass surgery or stent placements. And not only is that uncomfortable, but it's also a great big financial toll in the healthcare system. Here we have a treatment that's relatively inexpensive compared to those treatments, and people can start at an early age as a preventative strategy to prevent the onset of high blood pressure, narrowing of the arteries, heart disease, kidney disease, peripheral artery disease. It's really dramatic and amazing what the potential is for this.
Mm-hmm. Now, are there any side effects from chelation therapy?
It's very important that whoever is doing this type of treatment, what doctor is doing it, that they get trained by a reputable organization like ACAM, right, which trains doctors in the safe and effective treatment of cardiovascular disease with EDTA. But some side effects can occur with any kind of intravenous treatment. Right. Of course, there's always the chance of bleeding and infection at the site where the IV is started. In our office, we have rarely ever see that. The typical symptoms might be achy muscles, muscle cramping, because EDTA does pull out heavy metals and can pull out some minerals as well. Mm-hmm. So we always are recommending mineral replacement therapy at the same time as chelation therapy. And then I guess the other big side effect could be fatigue, mm-hmm, because of the mineral depletion. And again, mm-hmm, taking mineral supplements is super important, mm-hmm, and is recommended by whoever is administering the treatment.
Mm-hmm. Now, is it also important during the treatment to check the kidneys because of the heavy load that's going to come through the kidneys in getting rid of the heavy metals?
Great point, Dr. Heyer. It's the one. When EDTA was first started being used as treatment, they found that if a person got too much at one time, it could affect kidney function. Right. So it's recommended to check kidney function every 5 to 10 treatments. But interestingly, there was a New England Journal article that was published about 5 years ago that found that EDTA chelation could be used to prevent the progression of renal disease. So that means that people with chronic kidney disease also have a great treatment that's been documented in the medical literature, and it's been found to be very safe when done the way that it's supposed to, and prevents progression of kidney disease.
So that means also it actually have prevent the need eventually for dialysis and things like that.
And even kidney replacement. That's mm-hmm, that seems to be the case.
Mm-hmm. Mm-hmm. Now, I think you mentioned earlier something about oral chelation also, and EDTA is poorly absorbed, etc., etc. What other forms of chelation do we have then?
The other ones that are on the market from a prescription perspective, mm-hmm, are DMPS and DMSA. DMPS is a binding agent that was discovered and manufactured originally in Russia and China. Mm-hmm. And even though it's available in the United States, it's not FDA approved. Mm-hmm. DMSA, also known as Chemet, is available in the United States, and it's for lead exposure. Mm-hmm. And that actually is for oral use. Mm-hmm. So it's for kids that get lead toxicity. It's also for adults as well. Mm-hmm. And those are the two prescription medications, mm-hmm, other than EDTA. There are others, but they're much less likely to be used, like D-penicillamine or desferoxamine, which D-pen is for copper toxicity, desferoxamine is for iron overload. Right. And then there's a lot of natural supplements that are really great for helping to augment the process and actually work like natural chelators on their own. Right. So from when the heavy metals get stored in the tissue to getting out of the system, there's lots of intervention points, mm-hmm, such as we always recommend alpha-lipoic acid, which is an antioxidant that works almost like a shuttle, is how I describe it, mm-hmm, between the tissue to the kidneys. It helps, mm-hmm, to sort of chaperone the heavy metals out of the system. There is a product made by a supplement company called Metalloclear, uh-huh, that upregulates our body's ability to produce metal binding proteins called metallothionein. Mm-hmm. And that seems to also help with that shuttling process. Mm-hmm. Mm-hmm. There are certain nutrients that are, well, minerals are also very important to help with that process, like zinc, right, and selenium. Exactly. Right. And then, of course, chlorella is one of the great binding agents in the digestive tract, along with pectosol, which is a fiber binding agent, and those all work great together, mm-hmm, to complete the process successfully. Mm-hmm.
Can they work on themselves with certain people? In other words, that alone will do it?
If for severe, significant situations, I usually recommend a comprehensive protocol. But if a person is eating too much tuna fish and getting mercury exposure, it's probably taking chlorella whenever they eat a mercury fish meal is probably fine by itself to help prevent all that mercury from being absorbed and retained.
Can both be done at the same time, the oral, like chlorella and all those type of things, at the same time that they're having also the...
It's not heavily recommended. Well, yes, as a matter of fact, it should be done at the same time to use chlorella along with chelation therapy because it's comprehensive. The body works in many ways, and we like to take a comprehensive approach to not only pull the heavy metals out of the tissue, but make sure that we've got an exit strategy, open up that highway. And in fact, we should even be talking about drainage remedies as well to make sure the liver, kidney, and lymphatic system is fully open and there's no leaves in the drain to block the process.
Now, since you mentioned that, is there any danger that when you're chelating something out, that it may, let's say you are detoxifying the liver or somewhere else, that it may shift, you may clear the liver, but it ends up in another tissue somewhere else?
Yeah, it's a great, one of the possibilities of chelation therapy is that as you move the heavy metals out of one place, it could get moved to someplace else if the exits are not open. And that's why it's super important to work with a healthcare provider that understands how to make sure that the liver, kidneys, and lymphatic system...
And that you have the proper drainage.
So that the drains are open and the exhaust is open, meaning the person is having regular bowel movements 1 to 3 times a day. Because without an exhaust system, then everything gets reabsorbed and redistributed.
And then you have a problem.
Yes.
Well, we are coming to the end of our program. I want to thank you very much for being with us again today.
Thank you.
I want to thank our viewers for being with us again today. See you next time.